Adults should sleep between 7 and 9 hours.
I don't think
I said they should.
some of us,
Right,
because okay,
right.
wow, that seems like a lot of hours, but I think sometimes it's needed though.
Yeah, well, again, for good physical outcomes, that is what's needed. Interestingly enough, people that sleep less than that or sleep more than that, they're outside of that 7 to 9, they both have health problems. A lot more health problems.
Even
So
if you sleep more.
more is bad. And we kind of are speculating the reason more is bad
Yeah.
is probably because they have undiagnosed sleep apnea, so they're needing to sleep more to make up for their poor sleep. But then apnea leads to so many problems with health that if they don't die fairly young from sleep apnea, they just die younger than they should because of all the other health problems that arise from the untreated sleep apnea.
Welcome to Marco Rock TV. My name is Marco Rock. I'm your host for Inside a Great Mind, where we interview entrepreneur and leader for the purpose to inspire and inform you. Today we're so thrilled for our guest, Dr. Roubal, on the show. How are you, Dr. Roubal?
I'm fine. Thank you for having me.
Awesome. It's a pleasure to have you. So tell us who's Dr. Roubal.
You want me to tell about me?
Yeah.
Okay. All right. Well, I actually graduated from dental school many decades ago. And like most dentists, did general dentistry for quite a few years, at least 10 years. And then I started becoming very interested in helping people with special problems.
Okay.
Mostly headache type issues, jaw pain, neck pain, back pain, and so forth. And then I became aware that there was a connection between poor sleep, poor breathing, and pain as well.
Okay.
And so then I pursued that avenue and started getting into treating sleep breathing disorders probably in the late 1980s, so going way back.
That's a long time ago.
It's a long time ago, and frankly, we didn't know very much back then. So actually, I quit doing that procedure, treating with oral appliances in the mouth. I quit for about 10 years, and the reason I decided to stop doing it, I saw no predictability. And I like predictability. I like to be successful, so we just quit doing it. And then after about 10 years, there was some development of equipment, actually through Harvard University, and they could measure airway size and basically its response to jaw movement. So that made all kinds of sense to me, so I invested in that equipment and started doing more and more sleep. When I say sleep, I don't mean putting people to sleep. I mean keeping them alive while they're in sleep.
Yeah.
So what we do basically is we treat problems with sleep apnea, snoring, for those patients primarily that do not tolerate the traditional CPAP machines. And I would say about 75% of our new patients walking in the door do own a CPAP, and it's under their bed or in their closet. And so we help those people. And the last 10 years, I've been doing exclusively sleep disorder treatment, and so I haven't done any dentistry in over 10 years now. So limited practice, and I actually have two other dentists that help me, Dr. Brigden and Dr. Sheets. There's three of us here doing sleep treatment, keeping people alive.
So what is unique about your practice?
What is unique?
Yes.
Well, actually, what I just shared is unique. It's very unusual for a dental practice to not do dentistry.
And just for, because when I saw it, I got a little confused first. I was like, is it dental practice or is it sleep apnea?
We're much more like a medical practice than a dental practice. So we don't. You'll hear no drills whirring anywhere, and absolutely no dentistry whatsoever. But what also makes us unique is that we are board certified. We went through board certification to basically prove to others that we do know what we're doing. And the other thing that's very unique is that we are providers of virtually every medical insurance out there. So we bill things to medical rather than people having to pay cash, which is more common.
Okay. So what are the maintenance that's required for your device?
What are the methods?
The maintenance.
What is the maintenance? Excuse me.
Yeah.
Well, maintenance is really easy. So here we have an example of one of the appliances. And basically this appliance is cleaned with simply soap and water with a toothbrush. So it's really nice for travel. I hear that a lot, where I don't want to carry my machine around. It's just too big, so they aren't treated while they're traveling, and they have to go buy distilled water for the humidifier. With these little guys, they could put them in a small retainer box like orthodontic cases, and again, soap and water and toothbrush.
But then how do people know that a treatment's working for them when they're using some of your appliances and stuff?
That's a very good question. Thank you. That's the other thing that makes us unique. We do extensive follow-up home sleep testing.
Okay.
So we're measuring their apnea and their oxygenation levels while they're wearing the appliances. So we know when they're working, and more importantly, we know when they're not working,
okay.
so that we know we can make modifications to the appliance to get them effective.
So you talk about insurance in network providers earlier. Can you clarify on that, please?
Yes, it's very unusual for dentists to be in medical networks. So I'm not talking about dentistry. This is not a dental procedure. This is considered durable medical equipment. So if dentists are billing medical insurance, they have to be in-network providers. So we basically have hired people to do all of the pre-submission, so people know that's going to be a covered event by their insurance.
Yeah.
We know exactly what the insurance will cover, so the patients always know their exact cost of treatment before they agree to it.
I see. Wow, that's interesting. So let's talk about the sleep issue. So why does people have the issue like with sleep? It was a common symptom I'm sure they have seen out there from your experience.
Sure, and that's another great question. When I talk to medical providers about questions that they can ask their patients to discern if they particularly probably have sleep apnea, we should not be snoring. So the question I ask them to ask their patients is, has anybody ever told you that you snore?
That's my next question, actually.
And if people snore, there's somewhere around a 70% chance that actually they have sleep apnea. And then at that time, the medical provider would order a sleep test. There are home sleep tests, and there are sleep tests where you go to a hospital or a medical facility where you sleep overnight. So insurance companies, again, are really pretty much saying most of them have to be at the home sleep test. You're sleeping in your own bed while you're testing. Because frankly, it's a lot less expensive for the medical insurance companies. But they certainly do a good job picking up the sleep apnea, and some of them will pick up snoring and so forth. But typically, we treat the apnea, and the average person, their snoring is either eliminated or so mild that it's not objectionable any longer.
So you think that stress and maybe other social life thing is related to sleep apnea?
Well, basically, a lot of people, they have such poor sleep. They're either being awakened, there's something on their brain, they're stressed, like you mentioned, anxious issues. If you can't sleep, you can't heal. And so if we have poor sleep staging, not good REM sleep, not good deep sleep, then we're never going to heal, and we just feel so tired. And a lot of people develop depression, anxiety issues, and all the other medical issues, the cardiovascular issues, the high blood pressure, heart attack, stroke, not waking up in the morning.
Really?
Contributes to diabetes. I can go on and on. It's just, this is so underlying so many things that if somebody walks again into a medical provider saying, I don't think I'm sleeping very well, or I'm tired, or all of a sudden they're starting to have high blood pressure issues or diabetes or cardiovascular issues, first thing that I would do if I were a medical provider, knowing what I know today, is I would order a sleep test. You treat that, you're treating a lot of those conditions, perhaps even eliminating them. Dementia is another big one, and that could be the apnea itself, or it could be poor oxygenation during sleep. So we've had a lot of people that come in here and they've even been diagnosed with dementia. They have some cognitive issues, and we treat them, and that just goes away if the cause was poor oxygenation or sleep apnea. So we've had some great success with that.
So how do you measure if somebody's sleeping good without using like a test or going to a hospital necessarily? Well, do we evaluate that by the line of sleep or no sleeping at all?
Again, another very good question, and there isn't a really good way to do it.
Okay.
We'll have people come in like with Fitbits or Apple Watches, some of the wearables, and they do not, in my humble opinion, they do not correlate at all.
Okay.
And frankly, that's even the problem with some of the home sleep testing that's done. It tends to underestimate apnea events. So we do a lot of follow-up home sleep testing to substantiate what we're seeing. And we do a lot of that screening just to make sure that people have a problem or don't have a problem. And if they don't have a problem that we can measure, then again, we typically would send them off to a sleep specialist and see if there's something else that's not being uncovered just through normal examination, consultation, or even a home sleep test.
So how many hours should we sleep at night?
Adults should sleep between 7 and 9 hours.
I don't think.
I said they should.
Some of us,
right,
because
right,
okay,
right.
Wow, that seems like a lot of hours, but I think sometimes it's needed though.
Yeah, well, again, for good physical outcomes, that is what's needed. Interestingly enough, people that sleep less than that or sleep more than that, they're outside of that 7 to 9, they both have health problems. A lot more health problems.
Even if you sleep more.
More is bad. And we kind of are speculating the reason more is bad is probably because they have undiagnosed sleep apnea, so they're needing to sleep more to make up for their poor sleep. But then apnea leads to so many problems with health that if they don't die fairly young from sleep apnea, they just die younger than they should because of all the other health problems that arise from the untreated sleep apnea. Something like only 10% of people that have sleep apnea are ever diagnosed. 10% are diagnosed. So how many people are out there not only not diagnosed but not treated? And there's the big problem. There's a big problem.
Yeah. What are the techniques for the average person, to use to be able to maybe fall asleep quicker or have a routine or whatever to meet that 7 hours?
Well, again, if it's a routine problem, then we start concerned about the light coming from phones, coming from computers, those televisions, things like that. So there's a lot of buzz out there. You should stop those devices about an hour before bedtime.
Okay.
You obviously don't want to be drinking caffeine before bedtime. You want to have a dark room. You want to have a quiet room. You want to have a cool room. All those things help promote sleep. But in the back of my mind, when somebody comes to me with insomnia complaints, if we clean up all of it's called sleep hygiene. If you clean up that sleep hygiene issue and they're still having problems, I am certainly going to, again, recommend that they get a home sleep test at least to see if there's actually an underlying sleep problem. And I'm not sure this is medically accurate, but I always think maybe the brain's afraid to let you fall asleep. They don't want you to die while you're sleeping. And we find that actually quite a bit, where people have undiagnosed sleep apnea and you get that controlled and now they can sleep. Same thing, like we get a lot of complaints, people coming in where I've got to get up 2 or 3 times a night to go to the bathroom. And very bluntly, full disclosure, that used to be me. And after about a month or so being treated, one day I realized I wasn't getting up and going to the bathroom any longer. And so if we have good, deep sleep, we produce a hormone that really lowers the urine production during sleep. So that's why if you treat the apnea, again, if it's caused by apnea, you don't need to go to the bathroom. And so if you have to get up 2 or 3 times to go to the bathroom, what does that do to you? It just messes up your sleep. You may not get into REM sleep, or you don't have very good restorative sleep. So that's a huge issue.
So now, how do we encourage people to go with a 7 hours, 8 hours sleep? Because there's like a lot of entrepreneur leaders, people out there who's like, hey, sometimes we go to bed at 1 o'clock, and then we get up at 5. So there's a lot of risk for that. It's not good. So then how do we motivate people?
Well, first of all, just because not everybody needs 7 to 9 hours.
Okay.
again, the research is really clear. The less sleep you get, the more health risk that you're taking on yourself. And one of my concerns is that when one isn't getting enough sleep for them, and that's the question that no one can really answer, how much is enough sleep for them. But certainly people make errors in concentration and judgment. So I would not want to have a pilot piloting my commercial flight without sleep. And that's why, again, they're pilots, as I brought that up, they're required to have so much time off. Same with truck drivers. That's a regulated industry, and they require that they have that much time off to be able to sleep. Matter of fact, for instance, sleepy driving is just as bad as drunk driving in terms of accidents. So that's how bad it is. People they just make poor judgment. They can't think. And so, again, we hear a lot of people coming in there complaining of brain fog. Doc, I just can't concentrate. I just can't complete tasks. And again, that's one thing that actually clears up pretty quickly by treating them. So don't confuse 6 hours of good sleep to 9 hours of bad sleep. Sleep is not sleep.
That's different.
It's different in sleep, right? So that's why some people can get by with less sleep, because they have good sleep.
That's good. So, Dr. Roubal, if you happen to be an animal, which animal would you be and why?
Whoa. I've never really thought about that. Well, I know, sure, dogs are sure well taken care of. I suppose I want to be a dog. It's like a part of the family. And, most animals, animals in general, don't have sleep apnea. And so when we evolved to the point that we can speak, then that took away a lot of the support in our airway. And so that's why humans snore. That's why humans have sleep apnea. Now, I think it's the bulldogs, will do some snoring, some of the little ones, the little dogs. And if you look at them, their face is all pushed in, so consequently their airway is being compromised. But typically animals don't have sleep apnea because they don't speak. So that's where that comes from.
Okay, if you have a power to make one positive change in the world, what would that be and why?
This might sound a little self-serving, but I wish we would be able to inform the population that they need to be concerned about their health in general. Certainly, of course, our area is airway support and clearing, but the obesity is becoming a whole nother issue, and obesity does create more sleep apnea and more snoring. And a lot of people don't realize, they think of the large neck, but also our tongue gets fat, and so that's a whole nother issue. So I think we could, as a society, as a population, be much more, we'd be much healthier if we could have better control of our weight. And then again, if there's any, snoring or poor sleep, be screened, see if you have sleep apnea, and then get it treated. I think that really, people are happier. We have people to come in and they'll go, gee, my wife says I'm not crabby anymore. I'm a lot easier to be around. Those are really great things. And so I think that's a real important thing. I think just more awareness. Unfortunately, we have some people so afraid, they've heard such bad things about a CPAP, they won't go get tested. And the new machines are a lot better. And again, if they don't tolerate that well, the appliances are great. So there's so many other treatments out there that some people's surgery does help. That's not a first line in my mind, but again, that can be helpful too. Just people have more awareness of their health and take responsibility for their health.
So I think you might have already said this, but what would be your last advice tip to my audience?
What would be the advice to the audience?
Yeah, that's the audience.
Well, I hope if they've listened in, they would have some concern for their health and their well-being. Sleep is just so important for what we do. We can't live without adequate sleep. If we don't sleep well, we tend to gain weight. We have a tendency to be very difficult to lose weight because we don't produce the proper hormones that help us feel full, for instance. And so and I've never had a tired person come in and say, I just ran a marathon. or for that matter, ran a mile. So if you're tired, you're not going to run, you're not going to exercise, and we get great pleasure then in eating junk food if we're tired. So it just I think again, sleep is so critical to what we do. I would say the best message I could give to your audience is sleep well.
Sleep well.
Sleep well.
Yeah. Dr. Roubal, thank you so much for your time, for being on the show. We really appreciate it.
You're very welcome. Thank you.
Yeah.
Appreciate it.